MRI stands for magnetic resonance imaging. It basically uses a magnetic field and a radio frequency wave to create images of the structures inside the body. With an MRI exam, there is absolutely no radiation exposure. A typical MRI exam takes anywhere from maybe 30 minutes to about an hour. Each MRI exam is specifically tailored to each individual patient, so it depends on what type of exam you're coming in for. So when you come in for an MRI, we do have you undress for the MRI exam. We do ask that you remove all of your jewelry. We do have lockers that you can secure your belongings in that have keys, and you lock your belongings in the locker. We do provide hearing protection in the way of earplugs and also the headphones, which do provide an adequate amount of hearing protection. A few of our MRI machines have entertainment systems, which allows the patient to potentially watch a video during their exam. So the MRI machine makes different knocking noises, I would describe it as. Different decibels of knocking noises. Some scans are louder than others, some are not so loud. Some you may hear through the music that you're listening to through your headphones, some you may not hear at all. We do ask that you try to hold completely still during the loud noise when we're actually imaging you. When someone is extremely claustrophobic, we usually try to make it a point to check in with them in between each individual scan. Each individual scan sequence can last anywhere from 2 minutes to possibly 4 or 5 minutes. Patients tend to feel more comfortable when they know exactly what to expect during the exam. There are certain MRI exams that we do that require contrast. We put an IV in the patient and we inject the contrast, and that helps to highlight different parts of the anatomy that we don't normally see without it. It enhances the study. We currently use the safest MRI contrast that's on the market, and that's FDA approved. Sometimes when our patients are coming in for MRI exams with contrast, we require a creatinine level, so a blood work draw within the last 6 weeks. Normally upon the completion of your MRI exam, our radiologist will review your images and dictate the report, and that report is usually finalized within a few hours of completion of your exam. That report will then be forwarded to your doctor's office.